New data out from the Centers for Disease Control shows a steep rise in overdose deaths during the COVID-19 pandemic. That could be partly because social distancing limited access to addiction and mental health treatment for many. Q2's Mitch Legge takes a closer look at the problem.
In 2020, over the course of the COVID-19 pandemic, a record number of Americans died from drug overdoses. In Billings, the need for mental health care was much the same, with a record number of people reaching out for help to Rimrock Foundation in Billings.
The pandemic actually produced a second epidemic, and that is mental health crisis and an increase of substance use disorders. Our phones are ringing off the hook.
Nationwide, overdose deaths in 2020 compared to 2019 have increased by 30%. 92,000 Americans died from overdose in 2020, according to data released Wednesday by the Centers for Disease Control. The same data shows that Montana's overdose deaths jumped 12%, comparing 2020 to 2019. Last year, the state had 157 people die of overdose. That's 18 more than were recorded in 2019.
There's a high suspicion that a lot of people might be going without services. People are really struggling, and as we come out of the pandemic, they're really looking for solutions to deal with something that may have arisen during the pandemic. We've been seeing in the national news how there's been an increase of overdose deaths. We anecdotally know that that's happening in our own community too.
Kosevich said the Rimrock Foundation's Billings Mental Health and Addiction Center has seen the number of referral patients skyrocket over the past few years. Comparing the first 6 months of the past 3 years, the clinic has seen a 122% increase in people seeking services. In the first 6 months of 2019, the clinic saw 283 people referred for mental health treatment. 2020 saw 358 referrals, and 2021 exploded, with 629 people requesting help. Kosevich added that the best thing to do for somebody who is struggling with their mental health is to reach out for help in any way possible. Reporting in Billings, Mitch Legge, MTN News.
Well, the drugs most responsible for deaths in Montana were stimulants like methamphetamine and opiate drugs such as heroin and other prescription painkillers.